Welcome back to the show Talk with Your Doc. With me is Dr. Marlon Hagerty, and we are talking today about radiation treatment. Dr. Hagerty, we were just talking about external beam radiation and brachytherapy. Please tell us what are the different side effects of these two treatments?
It really depends where we focus the radiation. Of course, radiation could be given anywhere from head to toe, really. So it all depends on where we're treating in the body and what organs are affected. Also, even how much radiation we give. Sometimes for one kind of cancer, we can treat with very well with using a low dose of radiation, like lymphoma. And then sometimes we have to give a much higher dose of radiation. So the dose will affect the side effects and then where we use it.
Okay, so external beam radiation, the side effects depends on the dose. What about the brachytherapy, where you put the radioactive material within the organ itself?
So again, that depends on the location. We can use brachytherapy for different sites, like I was mentioning prostate and cervix, but we can use it for other areas as well. So usually it's more related to the risk of anesthesia. So normally for external beam radiation, the patient doesn't go under anesthesia. They just walk in and it takes a few minutes and they walk out.
Right.
For anesthesia, there's always the risks of that. Also with bleeding, like if for prostate cancer brachytherapy, you're going through the skin to put that needle into the prostate. And so you could have bleeding with that. And also organs where you're using that kind of radiation could have swelling, so the prostate can swell up, and that can make it harder for somebody to pee if there's enough swelling to cause that. For cervical cancer, when we use brachytherapy, there's a chance that when we introduce the apparatus to go into the uterus, you could, if the cervical cancer is a very big, aggressive cancer where it's hard to see where you're putting it in, you might need to use an ultrasound to help guide you. And there's a chance you could always put it in the wrong place. Of course, we're very careful to make sure we're doing the right thing.
So if a patient is receiving the radiation treatment, how long or how many weeks or how many months he has to take the radiation treatment? What is the duration?
It really depends on which area we need to treat. Sometimes we need to give a little bit every day for a long period. And I can think of head and neck cancer, for example, that can take 7 weeks, Monday to Friday, no weekends, no holidays, but we'd give it out over 7 weeks. That's 35 treatments in total.
So at a time, how long patient is there usually?
The treatment itself can be maybe around 10 minutes or so, but the time you're at the cancer center is more like 45 minutes. Yeah, and so we would give a little bit every day because when we're treating this area in the head and neck, there are so many critical structures that all have their limits on how much radiation that they can get. If we give a little bit every day, it can be tolerated more. If it's a lung cancer, a small tumor that's in the middle of the lung tissue, and there's nothing critical around there, we can give a very high amount of radiation just on one day and only have to repeat that 3 more times, like for 4 treatments in total. And we can cure that lung cancer with just four visits to the cancer center.
Now, patient has to undergo like this radiation therapy for 6 weeks, 7 weeks. Can they go to work? Or can they continue their routine activity while they are undergoing radiation treatment?
It depends again. So like I was talking about the head and neck cancers where all of these critical structures are in that area, it can be a very hard treatment to get through. And so somebody like that wouldn't be working during that treatment. But if it's prostate cancer and the patient is living in the area and they can come in for the daily treatments, usually that would be well tolerated, so they can still work if they wanted to.
And once this radiation treatment starts, is there any associated treatment along with that, like chemotherapy or any other treatment is to be given along with the radiation, or how does that work?
It really depends again on the type of cancer that somebody has. Sometimes we treat for cure with radiation alone. Sometimes we have to combine chemotherapy at the same time. And sometimes it's after surgery or even before surgery that we use the radiation. So it really depends on what kind of cancer it is.
So this different choices of treatment, radiation before the surgery, radiation after the surgery, or radiation with chemotherapy or without chemotherapy. Other than the type of cancer, are there any other factors which determine choice of treatment?
Sometimes it's the patient's preference. So sometimes it could be treated with radiation or with surgery, and so we ask the patient what they prefer. Or sometimes surgery isn't even an option for them because of their baseline health. So sometimes the treatment is kind of given without an alternative, a good alternative. Sometimes if the patient has had radiation before in that area, and we've already got to the limits of the healthy tissues about how much radiation they've already received, then we can't give any more radiation, so they might have to have surgery instead.
Okay. Now, when the patient comes, he's there for 10 minutes, 15 minutes. Who are the people who are giving the radiation? Is that any doctor involved or any nurse is giving the radiation or any technologist? What is this team composed of?
So the doctor, the radiation oncologist, would be there for giving any brachytherapy because it's a procedure that requires the doctor to do. If it's external beam radiation, usually that's done without the doctor around, and that's given by a radiation therapist. So they're experts in having the patient come in and aligning the body to be in the perfect position, and then we take x-rays to get them lined up on the inside and then do the treatment. And so that's their job. They do that every day at the cancer center, and so they run the machines basically.
So a radiation oncologist is a doctor, then radiation therapist is a trained person, is like a scientist, but is not a doctor, is that right?
Yeah, so they go to school. It's about a 4-year program, and so they would learn how to be a radiation therapist.
And who else is involved in the radiation treatment? Is there any nurse involved?
Yeah, lots of people. It's a very multidisciplinary corner of medicine, and so we have the doctors, obviously the nurses to assess patients, the radiation therapists to give the radiation. We have medical physicists, and they basically make sure that our machines are running. And when I prescribe radiation, they ensure that what I prescribe is actually delivered by the machine. We also have a dosimetrist, and so they see all of the anatomy that I want to treat and the anatomy that I want to prevent from having a lot of radiation. If it's a normal tissue and I want to save that tissue from getting radiation, they would see all of the requirements, and then they would help develop the calculations to provide the radiation plan.
Thank you, Dr. Hagerty. We'll take a short break and we'll come back again for the discussion. Talk with your doc. Thank you.